So, I love the specifics of my role within LPT because one, I love working with data, and two, the roles are dynamic and constantly evolving. So with the new challenges always on the horizon, and likewise opportunities to learn new things and develop innovative solutions to those challenges.
I really enjoy my role. It's really, really varied, and no 2 days are the same at all. I get this kind of the joy of both project management in my role, but also supporting people as well. So there's quite a lot of quality improvement work, but also supporting my staff, developing them and coaching them and supporting their development as well. I also work really closely with clinical leads as well. So that's just going to ensure that our admin team provide a really good quality of service, not only to the clinical team, but to our patients too. And that's really quite satisfying.
Well, I love working with the NHS just because it's really helped me with my own personal development. I started as an apprentice and now I'm an admin manager. So if it wasn't for the NHS, I doubt that would have happened. I've got two different roles. So the PA side is sort of managing the team leads and helping my sort of service lead. And then also I manage the admin team, which is sort of good for me to learn two different roles. So I love it. And I think no matter where you work in the NHS, I think we've all got the same goal as sort of providing patient care, and for admin or sort of providing that care to the clinicians as well.
I think the making a difference is a really big one for me. I do think that the admin roles have a lot bigger impact on patient journey and patient outcomes than perhaps we sometimes give them credit for. And so I've got immense pride in all of my teams and the work that they do, but also working for the NHS.
Okay, I enjoy doing my job as I feel as if we're providing a good service to parents in the community. As we register the births of the babies born in Leicester and Leicestershire, we also have to put the newborn blood spots onto the records, and we also have to make sure that all the records are up to date. It does entail a lot of detail and concentration to make sure that everything is accurate, but I also enjoy working and being a part of the NHS.
Hi, I really enjoy my job, and I must enjoy my job because I've been doing it for 23 years. The reason I enjoy it is because of the variety of the things I order. I'm not just ordering the same thing. And also one of the big things for me, although I'm only a team of two, me and my colleague Dawn, I'm part of the much wider team of Families, Young People and Children's Services and Leicestershire Partnership.
Well, I have to say that the pandemic has brought about lots of things, some of them good and some of them not so good. For me personally, the best thing that it's brought out is the feeling of support, and the team has been a massive part of that. We've been through the mill and back as part of the Children's Mental Health Service. We're there to support families when they need us the most. And by me picking up the phone, that's the start of that journey in that child's recovery.
I love my job. It's very varied. I get to work with a lot of incredible people across the organisation. For me, more recently, I have been working in the Incident Control Centre for the COVID pandemic. And as a team of 4 of us, we, as an admin function, we've been really imperative, I guess, in response to the pandemic. And I think sometimes we're often the glue that keeps a lot of this together. And I see that in many teams.